The uncertainty around the cost of healthcare is taking its toll on women like Mac Reed.
Oh, I'm freaking out, big time.
Mac is a freelance nanny, work that doesn't come with health insurance. She qualifies for the Affordable Care Act subsidies. That's federal financial assistance helping her afford insurance, which she says she can't live without.
I'm diabetic, so I need insulin. Insulin is the thing that keeps me alive. I mean, truly.
The subsidies drop the cost of her life-saving medication from about $500 a month to $86 for a 3-month supply.
It's been really, really helpful.
Come January 1st, if Congress doesn't act, that financial help will end.
You know what's going to happen is, like, I'm going to go bankrupt, and then my mom's going to go bankrupt, and then I'm going to die. Like, that's basically that's the, sequence of events if I can't afford insurance.
Making sure people like Mac can afford insurance has been an ongoing battle in D.C. It was the sticking point of the longest government shutdown in U.S. history. Democrats want to extend the subsidies. Republicans promised a vote on the issue this month. On Thursday, we talked one-on-one with Oregon Democratic Senator Jeff Merkley.
The Affordable Care Act subsidies are set to expire at the end of this month, and state officials estimate that some 35,000 Oregonians could lose this financial help. We know Republicans have promised Democrats a vote on this issue sometime this month. How's that looking? Is Congress close to reaching a deal?
Blair, you're absolutely right. Not just 35,000 will lose their health care, but the rest will be paying a lot more for policy. And many of them, that means they won't be able to make the rent or their mortgage or pay for the food on the table or other impacts. So this is devastating for Oregonians and people across the country. And yes, so a week from today, next Thursday, there will be a vote on a clean extension, a 3-year extension of the tax credits. So this is an opportunity for Republicans to join us and save this.
How confident are you that Democrats have the votes to pass that legislation?
Well, it takes 60 votes. I'm confident every Democrat will vote for it, but that's just 47. So we need 13 more Republicans to join us to be able to close debate and pass this bill.
Is it realistic to think that 13 Republicans will switch party lines and vote with Democrats on this?
We reached out to so many folks across the aisle, and as of now, it does not appear that they will join us in passing this.
So if this doesn't pass next week in 7 days, what is next for you?
I don't see any more opportunity before January that this is going to get done.
The lingering stalemate in D.C. leaves women like Mac bracing for what's to come.
It's very frustrating that my health is a bargaining chip. I don't really like that. I'm already worried enough trying to care for a disease that requires a lot of decision making in the day-to-day. I don't need extra worry on top of that. It just feels really unfair to me.
So Mac is one of more than 100,000 Oregonians who receive these subsidies. State experts predict over 35,000 could lose financial help if they aren't extended because their incomes are at or above 400% of the federal poverty level, making them no longer eligible for these enhanced tax credits. And as you heard from the senator, there will be a vote on this next week in D.C. If it passes, which is not looking like it will, it has to go to the House for a vote as well. Senator Merkley tells me he thinks it will take the president stepping in, urging Republicans to sign off on the bill. But President Trump did have his own plan to address this, and I asked Senator Merkley about that today. Okay, speaking of the president, there were talks that President Trump had a new plan to address the rising health insurance premiums. Reports suggested he was looking to renew or replace these tax credits. Have you heard anything in regards to the president's plan on this?
The only thing we've heard is that he'd like to send out checks to Americans and put his name on them. And a check is not going to buy you health insurance.
And we know Republicans, have been pushing back on this issue for quite some time now. It was the sticking point of the shutdown. What, if anything, are you willing to negotiate or compromise when it comes to a bill on extending these subsidies?
Well, listen, if the Republicans come back and say, hey, we'll take a 1-year extension instead of 3 years, I'll say, hell yes, sign us up. That's exactly what I pushed for, and what we put forward at the end of the shutdown was that opportunity for a 1-year extension.
Okay, now it's your turn. What do you think about the ongoing politics around these healthcare subsidies? Do you rely on them to afford insurance? Let us know. Email us at thestory@kgw.com or call and leave us a voicemail 503-226-5090.